Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you on this beautiful Wednesday morning as we count down to 2021. I am very happy to be counting down to 2021. I think most of you probably are too. That's something to look forward to, isn't it? But before we go into all that, Hawkeye,
yeah.
How are we doing today?
Numbers. Good. We're better.
Yeah, we like better.
We like better. We like going down in numbers, in acute patients, in recovering patients, all of that stuff. So right now we're at 56 acute infections, which is a lot better than 70s, 80s, 100. 27 of those are in the ICU, but still a large proportion on a ventilator, 20 on the ventilators, 71 in that recovery period. So really a greater proportion have been here a while, because if they're in that recovery period, that means they've been hospitalized for quite some time now, at least 10 days or more. And then 10 of those in that recovery period still on the ventilator. So again, once you do get on the ventilator, it is difficult to come off. It does take time to come off. But the numbers, I think, overall are much better than what we had seen 3 or 4 weeks ago. Hayes still has 24 patients, 18 in that active phase, and then so 6 in that recovering phase as well. So.
Yeah, so hopefully those numbers will keep going down, because I remember when you sat right across from me and you said when we were at 32, bad, very bad. And they were saying, good, it's better.
When
it's
the bar's
all relative.
100 or more and it gets down to 56, that's a good thing.
All right, well, thank you all for...
Can you clarify on the vents, too? Is that a total of 30 on the vent?
Total of 30 on the vent, 10 in that acute period, so that they've been on the vent at least for 20 days.
Yeah,
and
that's
then,
the recovering period.
Just under 20, and then the recovery.
Yeah.
Yep.
So that's still a lot. And anyway, so we're broadcasting live with you from the Dulles Simons Family Studio. We're delighted to be with you today. Our guest this morning is the President and CEO of Health Forward, Kiana Thomason. I think I said your name right. That was pretty good. Awesome. I rehearsed for a while beforehand. She will help update us on barriers to vaccination among people of color and what Health Forward is doing to help mitigate those health inequities. And that's really important, because I was reading this morning, Hawkeye, that only 20% of vaccine, of the 11.5 million doses of vaccine, has actually been distributed thus far in the United States.
Yeah.
We have some problems with public health measures and our ability to respond to a public health crisis when we've produced 11.5 million doses and only 20% of that has been thus far distributed.
Yeah.
That's a problem, because we've got to get that right. Hey, before we jump into our discussion with Kiana, let's first of all see if there's any reporter questions out there.
Hey, good morning, guys. Taylor, Channel 41. How are you this morning?
Taylor.
So I've got to ask about AstraZeneca, obviously, first, with it getting the emergency authorization in the UK. I know you talked a good deal about it yesterday morning, but just an update, too. And I may have missed it yesterday as you discussed it, but the interesting bits about its efficacy based on the strength of the dose given, that kind of thing, the reports being different based on half dose versus full dose, and just what your thoughts on now as we get ready for that new vaccine to possibly hit the market. I know it's just UK, but that new vaccine.
You bet. And I think it's going to come out in other countries today, too. I believe South Africa, another nation, is set to approve it. First of all, 60% efficacy is clearly not 95% efficacy, so that'll be a question for us. But it doesn't have to be refrigerated at ultra-cold temperatures, which makes this the vaccine for the world, potentially. They expect it to be the most widely distributed COVID-19 vaccine. I do think we're going to be very interested, Hawk, though, to see what the results are from the U.S., because though that trial is nearing completion, I think we heard from Dr. Pahoud and Dr. Castro yesterday. They thought it would be completed toward the end of the month of January. And in doing that, then it takes another, whatever time to analyze that data, and they'd start pushing it out. That's going to be really pivotal, I think, for the long-term outlook for that vaccine.
Yeah, I really can't comment any more than what we have seen in those news reports. We'd certainly like to look at any FDA briefs that come out showing all of their data. It's hard to say this 60 to 70% efficacy versus the 95% efficacy. I think overall it's going to be a positive thing, and it's going to add benefit. And I think there's probably going to be very little, so far from what we've heard or not heard, be very little downsides to this. But I really do need to wait for that FDA briefing for them to present their data.
And I think in the United States and other areas, they actually, so sometimes just to back up, some of the best science is accidental. right? If you think about how we invented penicillin for mold in a lab kind of I
Yeah.
mean, there's a lot of accidental science out there. And so what happened on the AstraZeneca vaccine is that to an error in dosing, I believe it was 2,000 people got a half dose for the first dose and a full dose the second time 4 weeks later. And those folks had a much better efficacy,
Yeah.
but it's a much smaller number than
Yeah.
the people who got the full dose twice. Now, people are left scratching their heads. They don't really understand the logic around that. And so as a result, AstraZeneca has organized a trial around the half dose followed by the full dose, I believe.
Yeah, it'll be interesting to see what happens. And there are trials going on all the time. There are still trials that are going to be going on with Pfizer and with the Moderna, all of these things, even though, they have the EUA. So this other trial with AstraZeneca, if it does start, is not unheard of and not uncommon. Again, even with the Pfizer and Moderna, everybody is still collecting data to really get the best numbers. And we'll have a much clearer picture probably 6 months from now, at least for those two vaccines. And then if AstraZeneca is approved, we'll have much more clear data, a much bigger group of people to analyze and see what the effects are, what the adverse effects are, and what the efficacy is.
So here are a couple of thoughts. So first of all, this is an adenovirus-based vector as opposed to a messenger RNA vector. We heard from Dr. Pood yesterday that the mRNA-based vaccines can be altered in about 6 weeks
Yeah.
if the virus actually changes. It takes longer with adenovirus vectors to do that, and even longer with the protein-based vectors. The good news is that because AstraZeneca's can be produced much more cheaply, $2 to $3 a dose, as opposed to $10 or $11 a dose, then the ability of this vaccine to be distributed to developing countries is much greater. And because the logistics around it are much easier around temperatures, just
Yeah.
normal refrigeration temperatures as opposed to any kind of ultra cold freezer or something like that. So we believe AstraZeneca hopefully will be impactful in terms of its actual outcome when we see the full scale data, and that it will then help us vaccinate the world. Because the only way we will get to a point where this pandemic is in range of being over is when we make sure we take care of it across the world, not just in developed countries, not just in certain communities in those developed countries. We have to get everybody taken care of on this, Hawk.
Yeah, and this is important for all vaccination strategies and programs. Areas that aren't the United States, that aren't as easy to get to, war-torn areas, other reasons that people can't get in to give aid or help, refugee camps. Even if there is a 60 to 70, 75% efficacy, if you're decreasing the amount of disease and the amount of severe disease by 60 to 75%,
It's a big deal.
that is a huge deal around the world. Yeah.
Yep. And we said yesterday, this is a call to arms, and I mean that in every possible way, to get your arm up, to get your vaccination, but also a call to be vaccinated.
Yeah.
It is a call to arms for us to get there.
Okay, we have 3 really quick questions for media. The Kansas City Star, Katie Moore wants to know, the Metro has recorded 322 deaths this month, a sharp increase from November, which had 227 deaths. A large portion, 146, have been in Johnson County. What's behind the uptick in the Metro deaths in Johnson County specifically, and what do you expect in the coming months?
It's a great question, Hawkeye. And I think, first of all, the overall death rate's just a reflection of the overall infectivity rate, right? When you have more widespread community transmission, more people getting sick from the virus, more people hospitalized, you're going to have more deaths. And we saw that throughout Kansas. The deaths were about 1,100 per day in the month of December, by far the highest month, and much higher even than November, and much, much higher than September or July or August. So we've seen an escalation of deaths. So it's not a surprise that that's true here in the Kansas City metropolitan area. Why the numbers escalated in Johnson County specifically, I'm not sure that I understand that as well. I mean, I think it comes down to where's the virus being transmitted and what population is it getting into the most. If you go back to the history of the crisis, you can see the numbers shift from area to area throughout the crisis.
Yeah.
So in some cases, the Northland had a higher attack rate, mostly because there was more nursing homes in the Northland. And then it was the eastern Jackson County area. And then now it's in the Johnson County area. And my guess is it's just where the virus is having the most transmission and where people aren't doing the best job of infection control.
Yeah, absolutely. And, if you do look on, and I know Katie knows this, if you look on star.com, they have, you can see that easy graph where you have the increase, the steep increase in cases. And only recently has it started to come down. Well, we know that hospitalizations lag behind infections by about 2 weeks, if not maybe even more. We know that deaths lag behind that as well. So we are still seeing some of the effect of that large, steep increase in that high peak. Looks like we're going down now in number of infections daily, but I think that has something to do with it. And of course, all the things that you mentioned as well.
Well, you know, it's interesting, just as a comment, I think that the mask mandate that came out from the Core 4, Johnson County was softer on that mask mandate, let's remember. The mask mandate was a really big move. I saw another article, I think it was in the Wall Street Journal this morning actually, that talked about how India, a much more highly populated country than the U.S., much more densely populated country than the United States, and a country whose infectivity rate was almost equal that of the United States, has a universal mandate. India now has a 75% less rate than the United States does, the U.S. does, for community transmission and for new cases. I mean, come on. The evidence is right here. We've got it from Mr. Fauci, Dr. Fauci. We've got it in India. We've got it in Kansas, where the counties that wear masks and the counties that don't are clearly different. I think everything tracks back to the pillars of infection control.
And the last question that we have has to do with the new strain that was first reported in the UK. Has now been documented twice in California, both in young men. I think they were in their 20s. Are we doing genome sequencing, and what do you think about that new strain? Is it here?
Yeah, the one I actually read was in Colorado, not California, and it was the first reported case in the United States. And I don't even know why they actually did genome sequencing on that. I kept trying to figure that out. I couldn't figure out from any of the reports or anything I read about it. But that person had not traveled at all, which just means it's out and it's in the community. It's throughout the United States, Hawk.
And we do believe that it also arises spontaneously, like in South Africa, in other places. So I think there are 2 cases now, both of they're males, and they are associated with each other because I think they work in the same area and they work in the same place. And I don't believe there is a history of travel. I don't understand why they did genome sequencing. I think it's been said that we don't probably do enough genome sequencing here in the United States in any specific local region. But we know it is there. But I think that just goes to show that you still need to do the masking, the distancing, that are not gathering in groups. Right now, again, there is no evidence that it causes more or less severe disease, or that there is evidence that it will not be, you won't gain protection from the vaccines. So right now there is no evidence of that. We still need to monitor and investigate for sure. But the other issue is that we do have the ability to do the genome sequencing, and that's probably one of the reasons that we found this initially. You know, I think England or the UK has been doing a lot of genome sequencing. We aren't doing as much here in the United States per se. But in general, yes, they found it in Colorado. I think understanding what has happened since March of 2020, you have to understand if it's there, it's probably other places as well. So it is so vitally important to do the masking, the distancing, the not meeting in large groups.
Yeah, and the infection rate of this viral variant appears to be 15% versus about 10%, so clearly more infectious. So what does that mean? Because you're not vaccinated yet by and large, so what does it mean? It means the pillars of infection control become even more important because they can keep you safe. That virus is only going to get out if you're not masked, and if you wear a mask and you wear it correctly, the chances of infection drop dramatically. All we have to do is look at the data about India versus the United States, or about counties that mask and counties that don't in Kansas. It's very, very clear. Wear a mask, stay safe. Don't wear a mask, you're playing Russian roulette. You know, if you didn't see it, there was a 41-year-old congressman-elect, previously healthy, got coronavirus on December the 18th, tested positive, and died yesterday.
Yeah.
No other underlying diseases. Had the best of healthcare. Ochsner LSU healthcare, outstanding place. 41 years old, previously healthy, no underlying medical problems. Don't let that be you. Wear your mask. All right, so let's turn. I'm going to say this right again. Names are not my strength. Can you tell that? Kiana? Yes. All right.
Correct. You got it.
All right. Well, welcome to our program today. It's a delight to be with you. Your camera keeps moving in and out of focus. I'm not sure what that is.
I know. I have no idea why that's doing that. I apologize. I know it's annoying.
Oh, that's okay. We're going to follow with you, though. It's awesome.
Yep.
All right, so tell us a little bit about what Health Forward Foundation is doing and your relationship to Health Forward. I mean, as I understand, you're president and CEO.
Correct. I'm president and CEO of Health Forward Foundation. The foundation is about 17 years old. We've been grant making for 15 years, and we grant make on average about $20 million a year in our service area, which includes all of Kansas City Metro and 3 counties in Missouri, 3 counties in Kansas, including rural counties. Lafayette in Missouri and Allen County in Kansas. Our mission is to provide or promote leadership advocacy and resources that do 2 things: eliminate barriers to health and promote quality health for the uninsured and the underserved in our service area.
That was a lot right there. That is an especially important mission at this time. Because we need to help work on the barriers around vaccination. We started this program, I was quoting some data about only 20% of vaccines been distributed yet. And I know it's early and we're trying to get to healthcare workers, but it reflects a problem and a challenge for us, which is how are we going to immunize people in sort of this mass immunization we're coming on. We're going to immunize 330 million people, or as many of those as that are willing. How are we going to reach into communities of color, minority communities especially, with a history of experimentation medically and maybe a little bit of distrust?
Yeah, I think you're right in terms of the need to understand and address the barriers to vaccination first. We know that vaccine hesitancy is an issue for many communities, but it's more prevalent in communities of color. So first, I think just like any other problem, you have to start by understanding the problem before you attempt to fix it. Many times people hearken back to Tuskegee and that experiment, which was, of course, a grave and gross trauma committed against Black men, but there have been so many others, including present-day experiences. So historically, in addition to Tuskegee, we have the immortal life of Henrietta Lacks, who, as you may know, Dr. Stites, whose cells were used without informed consent and to research cancers, different reproductive cancers. And her cells are still being used today, legitimately today, however. But historically, were used without informed consent to research different types of reproductive cancers. So we also have J. Marion Sims, the father of modern gynecological services, who performed gynecological procedures on enslaved women without pain medication. And those procedures and experiments were used to build modern day medicine in gynecology. So there are many other experiences outside of Tuskegee that historically that have created this level of mistrust based on gross scientific and abuses by our medical community. Currently, we are still experiencing discrimination and bias in healthcare, all people of color, not just African Americans. However, the African American experience is unique in that oftentimes we do not receive the same level of attention and care and treatment with respect to pain management. It has been promulgated in medical schools across our country that Black people have a higher pain tolerance, and we do not. And so for other people of color who may have other language barriers, oftentimes they are treated as if they're inferior. We're not giving them the time to taking the time to understand matters in a way that they can understand it from a medical perspective. So there are layers of mistrust that are quite complex that go well beyond Tuskegee. And so I think as a medical and scientific community, first we have to build trust by understanding, taking the time to educate ourselves and understand where this mistrust is coming from, and then building segmented solutions to address the hesitancy and mistrust that people of color possess.
Yeah, and for good reasons. You mentioned Tuskegee, and as I recall, did it as an experiment run on African-American men without their consent, without their knowledge, and having syphilis go untreated to see what the long-term effects were. That just, I mean, that puts chills down my spine. I mean, that is such a gross misjustice and miscarriage of health care. So this is a great mission that you have. Tell us some of the steps that Health Forward is doing now and getting ready to help implement around messaging and trying to get vaccine into communities of color.
Sure.
And Kiana, This
Yes.
is Jill. We wondered if perhaps if you scooted a little closer to the camera, if it
Yeah.
would stop trying to focus.
I think
I am
she tried that
scooting
earlier. I watched her
closer.
move up and down. In
Yeah, you saw me scooting forward and
and
back.
out. Yep,
so
yep.
I apologize. How's that? Is that better? It's still.
Yeah, it's still doing it, but let's keep going. You know, what are we going to
Yeah.
do? Yep, yep. So talk to us again about what
Yeah.
is Health Forward going to help us do to help access minority communities? Because we share that concern. I mean, we're in Wyandotte County here at KU. We try to reach into the county. I think we do an okay job. There's always more that we can do and do better. Help us understand, what is it we need to do as healthcare private providers around the community and around our country? What do we need to do to help make sure we get everybody vaccinated?
Sure. Well, Health Forward Foundation is focusing on education and engagement with our directors of health at the Missouri and in our bi-state area, Missouri and Kansas, as well as our local public health department leaders. And are building a multi-channel education campaign, print, radio, television, regarding education, specifically to communities of color and our rural community partners. It's important to segment this messaging because we cannot assume that all experiences are the same. I'm sorry, hold on one moment.
Child's voice in the background, was that you?
So we can't assume that all experiences are the same. And so we intend to have town hall discussions specifically with these different community members to address their concerns, to let them air their concerns regarding mistrust, and to bring medical practitioners who look like them in front of them to speak to those concerns.
Well, that sounds like a great plan, and I know this is a challenging time, I think, for for race in the United States.
Yeah.
First of all, Black Lives Matter. I've said it before. In my home, Black Lives Matter. My wife's African American. Those are issues we talk about with our family every day. And then there's another example of a shooting in which you can how did that happen? And then you look at the injustice traditionally in healthcare in the United States, and now you're confronted with vaccination. We have to keep everyone safe. And even today, it's announced that Texas, Florida, and Ohio are going to deviate from the recommendations from the CDC and start doing people who are over 65 and not doing essential workers who are largely from a minority community. So I think the story, and you can always rationalize it and come up with the answer. But at the end of the day, that can only breed more distrust. I think the only way to build trust is to be transparent and honest and have real conversations about it.
I agree. I think we first have to start by educating ourselves and spend time, get proximate to the problem. It's not enough just to listen to the news and hear about the hesitancy and the mistrust. We have to engage. We have to start by having conversations like this with one another, of people of diverse racial and ethnic backgrounds, to understand firsthand what is your lived experience in medical spaces. Let's start there. What messaging has been passed down to you through your familial line in your cultural sphere that contributes to how you interact and how you trust and or mistrust the medical system. So we have to start by getting proximate, right? Proximity breeds care. We know from an abundance of research that clinical outcomes are improved when care is delivered by someone with cultural proximity, because care is often more culturally resonant or at least culturally responsive. So that means as a healthcare system, including our local public health departments, we have to first start by being introspective and asking ourselves, what do we need to do to be more culturally responsive in care? That starts with workforce, to include governance, all the way down to clinical care delivery and engagement, making sure that we have several Black and Brown practitioners, researchers, pathologists who are employed by our organizations who can understand and translate and be at the table to ensure that a lens that is culturally appropriate is being applied.
Yeah, and it feels like we have to celebrate when there are important leaders who come from communities of color and who provide that leadership. And for example, headed somewhere, Fauci's lab, the head of Fauci's lab, is an African-American woman who helped develop the Moderna vaccine. Where is that story? To me, those are the kind of things that sometimes we miss when we have the opportunity to try to establish that trust. Jill, let's turn to questions from our community.
We do. We have lots of questions, but first, we
Yes,
have a
ma'am.
special guest
We
who
do.
wanted to visit with you and Dr. Hawkinson.
Okay.
And it is the Executive Director of Shadow Buddies, and her name is Marty Postlewhite. Wait, Marty?
All right,
Good
Marty.
morning. Yes.
Good morning.
How are you? How are you guys doing this morning, doctors?
We're good. We're good.
Very good.
I'm trying to find this on my script, Marty. I didn't see this.
Oh,
Jill, what are
no.
you doing here to me?
No worries. I'm going to take over from here. And we just wanted, as a nonprofit, we've been servicing Kansas City and
Thank
worldwide
you.
and throughout the United States.
All right.
Not to anything that we knew was coming down the pipe this year. Every year we design and develop a new line of Shadow Buddies. And this year I decided to design the Courageous Crew, which consists of a nurse physician buddy, we have a police buddy, we have a first responder, we do a military buddy, and then we have a buddy for the fire department. So it's been a little difficult to get out this year with COVID, but on behalf of Shadow Buddies in the community, we wanted to support the physicians at KU and donate 100 of these buddies to you. We did a special delivery last week of Christmas and delivered over $10,000 worth of toys, escorted by Santa himself and the federal agents in our community, to allow kids in the hospital to have a great holiday, knowing that with COVID and the guidelines that many of these toys are only used once and go home with the children. So we wanted to make sure you guys had a great supply at the hospital. And again, wanted to thank you so much for all that you do, all that you inform our community, and we bless you and know how much that these buddies would be used in the hospital, but not only for you, but they're also a great tool to take home and provide that educational piece to your children, especially when the frontline workers this year have been taken away from their homes for extended periods of time. And they've also had to spend time away from their families. So we thought this would be a great way to end your year, to be able to have some of these buddies to provide that emotional, psychosocial support to your families and your staff.
That is awesome. I'm going to make them there. I'm going to get it right up here. Just a second. I'm almost done getting this organized. Yes, I got it done.
Yay!
Thank you. This is the best.
Oh, you guys are welcome. We have a lot of family, and you do a lot of good for our family being treated there. So again, you know, taking it step by step, piece by piece, we really hope to make an impact and have a little bit of an easier time to get them distributed into the hands of the physicians and our frontline crew who have given up their lives and have served us diligently this year. And we thank you on behalf of Shadow Buddies.
Well, thank you very much, and we so appreciate
Yeah.
that, and so appreciate the great work that you've done for our community and all that you've done to help bring attention to the COVID-19 crisis and its impact as well on minority communities and across our entire community. We're all in it together, and we're only going to get better together. We can't get better separately. So thank you so
I
much
agree.
for the work you do.
You are welcome. Thank you, and keep up the great work, please.
Bye, Marty. Thank you.
Thank
Thanks,
you.
Marty.
Thank you, Jill.
All right, so our first question today from the community is, based on what we're seeing as far as cases and hospitalizations falling, and given that most metro school districts have been remote since Thanksgiving, do you think it's likely that schools perhaps are more involved with transmission than originally thought?
You know, Hawkeye, I think this is a hard question to untangle. This one actually came to us last night, and I was trying to do a little reading and trying to figure that out. You know, it's difficult because there are so many moving pieces right now. Schools came back out of session right before Thanksgiving, but on the other hand, we had Thanksgiving, and we also had the mask mandate. All three of those things kind of came together at a pretty quick timeline. I think the only real way we're going to know the answer to this question is with greater time. my belief is that school environments are safe
Yeah.
as long as they're de-identified
Yeah.
and people wear a mask. I think our challenge is when kids from school go out and congregate after school. I think that's what the challenge is going to be, Hawk.
Yeah, and I think there is some research behind that, and I can't remember if it was published in maybe the JAMA network, but showing that really there have been so many systems and protocols put in place for the environment, for the buildings of the schools, that most of those school environments are safe, but it's when the children or the families are getting together outside of school, whether it's the athletics or it's other groups or it's just getting together socially. And that's where the problem comes in. But I think a lot of the school systems, a lot of the particular buildings have taken those measures to make it safe for the children and also the adults in that school.
Ann Null writes to Health Forward. She says, great job. Thanks for making a difference. She wondered if you could speak a little bit and answer the question about how Health Forward originated financially. She thinks it was from a federal mandate. Could you speak to that?
That's a great question, because, I think Health Forward traces back to the sale of HCA Midwest, if I remember.
That's correct. So Health Forward Foundation is a health conversion foundation, and we originated from the sale of the Health Midwest Hospital, which was a nonprofit hospital, to HCA. And a portion of the proceeds of that sale created Health Forward Foundation and also the Reach Healthcare Foundation.
And what is it called in Wyandotte County? There's one in Wyandotte too. Was that Reach? Which one is in Wyandotte?
Yeah, Reach Healthcare Foundation is our sister foundation. However, we share the same service area. So they are located in Kansas. We are located in Missouri, but we both cover all of Kansas City and then the same counties in Missouri, Cass, Lafayette, and Jackson, and then the same counties in Kansas, Wyandotte, Johnson, and Allen.
And I just want to say, for those of you who don't know, these two groups do amazing work. I've been involved more with Reach because of some work that KU has done in Wyandotte County, but both are so similar, and they've really helped us a lot, especially reaching into underserved communities. Can you give us some examples, Kiona, of some of the grants that you all have done to help support healthcare in underserved communities?
Absolutely. Well, Health Forward is a anchor institution for our federally qualified health centers and our free clinics. So the healthcare clinics where individuals who do not have insurance go to receive healthcare. Beyond that, we fund a significant span of organizations, all the way from domestic violence shelters to schools, homeless shelters, anywhere that healthcare, behavioral health, and oral health is provided, or wraparound services, human services to support access to healthcare or better healthcare outcomes is where we fund. It also includes community organizations around healthy eating and active living, and we have a significant history around tobacco mitigation and led the initiative to raise the legal age for tobacco in Missouri, as well as led on Medicaid expansion across the state of Missouri.
Yeah, that's such great work, and to say that I know Vibrant, which is the FQHC that KU was involved with in getting off the ground, has been really supported by Reach and by others, and I think by y'all, and it's just those kind of partnerships are so important in order to get into communities and get people care where they live, and not try and say, hey, you got to drive 20 miles. Oh, wait, the transportation's an issue. Oh, wait, the bus system doesn't work. You've got to be in communities to deliver care appropriately.
Agree,
so
and I would be remiss if I didn't call out the great work that is happening by Vibrant Health in conjunction with the Unified Government of Wyandotte County Health Department and the Wyandotte County Health Equity Task Force. They are doing amazing work with respect to testing, tracing, and now vaccination.
Yeah, they are, and to say I'm on the board, so I had full disclosure, I'm on the board of Vibrant, and so I'm a true believer, so I got to be a little careful with how much I say about it. But they have done great work in Wyandotte County, and I think are a real force to help us improve the county. When they became an FQHC was it 2 years ago now? It's going to be, that is a transactional moment for Wyandotte County. It's really going to be impactful, I think, for many years to come, so.
Amanda wants to know your thoughts. Do you believe that possibly the dramatic increase in cases recently is a result of the UK variant spreading in our area?
Oh, great question. Because, we don't do a lot of genomic analysis, Hawkeye.
Yeah.
But my guess is that's not the case here yet.
Yeah.
The only real way to know is genomic analysis. I think you'll see a lot more analysis in the U.S. trying to figure that question out.
Yeah, I think they initially discovered that UK variant either in late November or very early December. So I don't know that we have evidence of that. Again, I still think it's more behavioral than anything. And if you're doing the right actions behaviorally, you will be able to stop the spread. So I think it's more of a behavioral issue. Certainly those things will be done, looking at genomes. Hopefully it will become more, but it's not like the United States is not sequencing. We are doing a lot of sequences. There is a lot of sequence banks. It's just maybe not as readily, especially in specific areas, as maybe some of the other countries or regions are.
Yeah, but the fact that it occurred in Colorado with somebody who hasn't had a travel history means that, okay, it's out there.
Yeah.
Right? We can't
Yeah, you have
avoid
to
that. It's
believe
out
that.
there.
Yep.
Yep.
All right, Lindsay writes, if someone passes away in a Johnson County hospital, but their residence is somewhere outside Johnson County, where is that death recorded? In Johnson County or where they live?
You bet, Hawk.
I thought it was the county of residence. We know that for testing and positivity, it's county of residence. So.
Yeah, the hospitals have to report that mortality as their mortality if you die in the hospital, but I believe it is your county of residence in which that's attributed to.
All right,
We'll
Bonnie
verify
asks-
that. We'll verify that.
Okay. Bonnie asked, do you recommend a mask and a face shield for high-risk people who need to go out in public?
Okay, Hawk, what do you think about both mask and face shield?
Yeah, I think that's a responsible thing to do. I would never say don't do it. I think it's one more. You need the mask. We know that face shields do not constitute barrier protection. But whether it's a face shield or those large, industrial goggles or hardware store goggles to cover the tops and the sides
Oh, you
to protect your
goggles?
eyes.
Goggles like this, Hawkeye?
There we
In
go.
which I look so good and just, totally awesome.
Yeah.
Yeah, there you
Absolutely.
go. There you go.
So
Look great.
any of those, I think, is just going to offer more protection for you.
And so from your standpoint, let's talk about something you just said, and let's remind our public. Are standard masks, cloth masks, or these kind of yellow masks, but are they barrier protection? Do they protect you or protect the person you're next to?
Yeah, so they protect the person that you're next to was the main goal, and we have said that from the beginning. For the community, we're not talking healthcare facilities. They protect the person next to you because it is either filtering or blocking a lot of those droplets in which the virus is on and in. But we know that even those 2 to 3 layer cloth masks do provide the wearer with some amount of protection as well. So it's a dual kind of protection there.
Robin wants to know about fertility. She doesn't specify if she's talking about COVID or the vaccine, but she wants to know if you know of any known impacts on fertility in men and women of childbearing age. And just a footnote, we do have Dr.
Kevin
Ault
Ault.
coming up on Monday.
So we'll probably let him help us answer that
Yeah.
question on Monday, but I know one way you're not going to be fertile, which is if you're not healthy. And so one way to look at this, I think, Hawk, is to remember that the vaccine will help you stay healthy. I'm not seeing any reports. I'm not seeing anything at all about infertility from the vaccine.
I'm not either, and I think Dr. Ault had addressed this maybe the first time he was on, especially for women. There's no evidence of infertility with the vaccination, but we do know that we can find the virus in men's semen. We don't know the full impact of that. It may have no impact at all. It might just be the RNA. Who knows? But certainly, you are probably worse off if you get COVID-19 than if you get the vaccine.
Gene has an interesting question. Sorry. He says, with this new, more,
Transmissible strain.
thank you. I don't know why my brain just did that, but he wants to know, is there more that they can do to stay safe? More than 6 feet, more than an N95, more than cloth masks?
Yeah, that's a great question because I think the pillars of infection control are still totally operational. The problem is if you don't follow them, you're more likely to get it.
Yeah, 100%. Yep.
So do you think that you need to wear an N95 mask versus a surgical mask or a cloth mask in the grocery store and places like that?
No, I still, I've never been fitted for an N95. I still feel safe with what I'm doing in the hospital, even if we had the UK variant patients in the hospital, I would still feel safe. Again, it's going to be distancing as much as possible, 8 to 10 feet if I can. If I need to do an exam or a procedure, I will do it at that point. That's a very short amount of time. It's not going to be 15 minutes or more. Again, the masking. Otherwise, just out in the community, not meeting in those large groups, continuing to do the masking, keep those bubbles very small right now, and just keep your distance as much as possible. 6 feet is good, 8 to 10 feet is better.
Okay, and Terry wants to know, how does Hawkeye feel this morning? Any soreness or other
I was
reactions
going
to
to
your
give it about that,
shot?
Jeff. First of all, can I give you a hard time?
No.
Yes, I can. You were on the top of the website for the Kansas City Star yesterday.
Well, the health system was.
Yeah.
We were promoting vaccination.
You looked good.
And I think, it goes to, just as our guests had talked about, not just for me, but for everybody. And we know that it is a horrible, sharp, dual-edged sword, especially for the minority populations. When there is that vaccine hesitancy because of what has happened in the past, but there is also that the other edge of that sword is that we know that a large proportion of minority workers in the hospital and healthcare are in those high-risk populations, and they have been devastated by this disease since it was brought to the United States. So
how do
hopefully
you feel?
that's just a message. I feel good. The shoulder is still a little bit sore. It's not any different, really, though, than in October when I got the influenza
Flu shot.
vaccine. I didn't have any of the other systemic symptoms such as headache or fatigue or anything like that, and the shoulder soreness is going away. So,
Okay, so let me ask you this. Can you take Motrin or Tylenol or something like that before you get the shot?
I think you can.
It doesn't reduce the effectiveness of the shot.
It doesn't reduce the effectiveness of the shot.
Okay, awesome. I'm going to be getting my shot soon, and I'm going to make sure I do that.
But I would probably do it, maybe a couple hours afterward, because it wasn't until afterward that I got the pain. If you take
Yeah.
it too early, that pain relief may wear off a little bit.
BID for a day or two.
It lasted through the night,
Yeah.
But
Yeah,
I
there
would
you
probably
go.
start with Tylenol,
Okay.
Shalene has a question. I don't know if this may be a myth buster, but I don't know. Is it true?
Mythbuster, let's do it.
Is it true that it's possible for COVID-19 to take a page from HIV and other retroviruses and integrate into people's chromosomes?
Great.
Well, that is
Is
clearly
this
a
a
Hawkeye
cause for
question.
someone to be a long hauler?
This is a Hawkeye
No,
question.
so this isn't a retrovirus. Okay, this is just an RNA virus. There is no indication that it gets into the nucleus where our DNA is, such as HIV does. So right now, there's no evidence that it happened. There's no evidence of integration into the chromosome. So the short answer to that is no. They're very different viruses.
And Paul wants to know, why did Hawkeye choose Moderna vaccine over Pfizer? And what are you going to be
Gonna get-
getting?
okay,
What are you
well-
going to choose?
Yeah, that's easy.
So, it's what we got, right? It's what we have
Yeah.
on supply right now.
Yep, and Adam answered it on air yesterday. It wasn't a choice. Again, I did not get my vaccine until it was my time, based on my time and intensity of exposure to COVID patients. We certainly had many more employees here who are exposed much more than I am. And so by that time, the Pfizer shipment, the Pfizer vaccine allocation that we were using had been used on those other employees. And so when it was my time, the only available vaccine was Moderna.
And I think when my time comes available, and I think it's coming up pretty soon, then it will be whichever we have available, and whichever one I'm offered is the one I'm going to take. And I'm not going to worry about it. I think they're pretty. Those two vaccines are so much more similar than they are
They
different.
are.
I'm not too concerned about that.
All right, and Stacy asked, does the vaccine affect thyroid?
Would not heard of that one.
We haven't heard any,
Yep.
I don't even recall of that in any of the FDA briefs from Moderna or
either.
Pfizer either.
One more question.
Okay. Sorry, my phone did a thing. If you tested positive for the virus, Maria wants to know, how long should people wait to get the vaccine, or can they even get the vaccine?
Okay, there
Yeah.
you go. We tell
Yeah.
people you can get the vaccine, you
Yeah.
probably ought to wait a little while.
Yeah, and our guidance because of that is just because you have some immunity, we want to make sure we get the vaccine to those others who have not been exposed to the virus yet and who don't have any immunity. But you can get the vaccine really at any point. I would wait a couple weeks, certainly would wait probably 2 or 3 weeks after you have the infection, maybe 4 weeks, but you can still get the virus. But our guidance right now has been, if you've had the infection, then it's probably good to wait 3 months because you will have some amount of immunity, and let those other people who have never had exposure to the virus or have been infected with the virus get that vaccine to build up their immunity.
All right. Well, as we wind down today's program, let me first say thank you to Marty for having these awesome shadow buddies, and they look good right here. So any final thoughts from you today, Marty?
Oh my gosh, no, I think you guys have been extremely educational, but I'm just finally happy that I've been able to get the buddies into your hands. And moving forward, maybe we can get some more out there into the community and really help your families, help the physicians, and do our job to provide a little small piece of hope, comfort, and compassion back into our community. And thank you again for allowing me to share my story and to brighten your day.
Well, thank you. Kiona. All right. So, man, you did a great job. Final thoughts from you today about the Mission to Healthcare Foundation, or the Health Forward Foundation, and the great work that you and your team are doing.
Yeah, we would just love for our healthcare partners to join us and really engaging the community. We will be doing some town halls, both for the rural, immigrant and refugee, Latinx, and African American segments of our community. And so we are looking for practitioners who can speak on this subject, who share cultural proximity with our community members. So definitely reach out to me if you have interest in participating in one of our town halls and educational sessions. And I just can't underscore enough the importance of our healthcare community, really focusing on diversifying our healthcare workforce, use of community health workers who also share cultural proximity with our community members for education and messaging.
Yeah, thank you. That's brilliant. I bet let's figure out how to connect, because I'm sure KU would be happy to help with your efforts, and that is so darn important. Hawk?
I'll be in touch.
All right. Final thoughts?
Thanks to our guests, we are going to be heading into a new year, but nothing changes as far as the virus, even with this UK variant. We know it's in America now. But the best things you can do to protect yourself and your family continue to be those things that we've been talking about. Distancing, masking, not meeting in large groups, hand hygiene, doing all those things, those pillars of infection control, because even that variant is going to be stopped. A lot of this is behavioral, and so if you can protect yourself and your family by doing those things, moving forward, the vaccines for the mass populations, the general public, are fairly close, a lot closer than they were 2 months ago. There will be time. Just do those things now, be vigilant, and continue to be safe.
I want to say a special thank you to our two guests today, because I think y'all are both heroes. The work that you guys and your organizations have done in the community, your teams, you're heroes. And to Marty and to Kiona, I just can't say thank you enough. And I see it every day as a board member for Vibrant. We see it in our shadow buddies. This is awesome. You guys are heroes. We're going to return to that point. Hey, on Monday, Dr. Kevin Ault, who is an OBGYN and on the CDC Advisory Committee for Immunization Practices, will be joining us. He's been on with us before, but Kevin is a local but also national vaccine expert, as well as Dr. Angela Myers, the Division Director of Infectious Disease at Children's Mercy. Angela's going to help talk to us a little bit about the inflammatory syndrome being seen in children, as well as about returning to school safely. Another great program. Remember, we're not here the next 2 days. On Thursday and Friday, we are back on Monday. Again, let's return to the theme of heroes. We've had this discussion before, but let's have it again. We've heard from two great heroes today, with Marty and with Kiona. And now we also have to ask you to be a hero again. And why is that? Because you have to remember that this weekend, we haven't said it much this week, But we've got another major holiday coming up that often represents a really large party opportunity. Well, now it appears there's a little more aggressive variant out there for transmission. It's in the United States. It's probably in our community somewhere. But more importantly, SARS-CoV-2 in its known form is still highly transmissible. So you're coming up on New Year's Eve. There is a natural inclination to want to get together. We are so tired of this crisis, and we want to welcome in 2021 to be a truly great year. How do we do that? How are we going to welcome in 2021? Are we going to do it by congregating and doing the things that are going to make our community worse? Are we going to do it by saying, I love you, by wearing a mask, by staying distanced, from having a quieter New Year's Eve? Because you see, that's going to make you a hero. We need you to be a hero. You've heard a lot, some great work being done. But don't lose this opportunity. Be a hero. Let's welcome in 2021 in the safest way possible, because 2021 is a game changer. There is vaccine. There are new therapies. There are monoclonal antibodies. There is real hope. But that hope can best be realized if we continue to follow the pillars of infection control, like a good shadow buddy or like Anthony Fauci. We know the right thing to do. Be a hero. Do the right thing. We'll see you on Monday.